Okay, welcome everyone to a new deep dive. Today we are tackling a subject that, well, it's genuinely life-changing for many people. We're talking about bariatric surgery.
Yeah, it's a topic that carries a lot of weight, literally and figuratively.
Hmm.
And getting clear information is just crucial.
Absolutely. So to guide us, we're focusing on a really comprehensive source today. It's a Q&A guide called 100 Questions and Answers About Bariatric Surgery by Dr. Atef Ahmed.
And what's really valuable about this particular book, I think, is that it's written for both patients and medical professionals.
That tells you something, doesn't it?
It does. It suggests a level of detail and practicality that really goes beyond just the surface stuff.
Exactly. So our mission here for this deep dive is to sort of unpack this resource, cut through the noise a bit. We want to pull out the essential knowledge from the source, help you understand what bariatric surgery really involves, the potential upsides, the risks, what it actually means day to day.
All right, so you can feel informed about what is, let's face it, a pretty significant medical option.
And the Q&A format the book uses is great for that, I think.
Oh, definitely. It hits those questions people most commonly have, directly from the source's perspective.
Okay, so let's dive in. What does Dr. Ahmed's book actually tell us? It seems to position bariatric surgery primarily as a treatment, right, for severe obesity and the big health problems that often come along with it.
Yeah, things like type 2 diabetes, high blood pressure, sleep apnea, heart disease, the list goes on.
And the potential impact the source describes on those related conditions is, well, it's pretty fascinating.
It really is.
Yeah.
It goes into detail about how the surgery can lead to significant improvement, sometimes even complete remission, especially for many patients with type 2 diabetes.
That's a huge point right there, isn't it?
It is. And the book explains this isn't simply about cutting calories. Procedures like, say, the gastric bypass or the sleeve gastrectomy, they actually trigger hormonal changes, affecting gut hormones, GLP-1, ghrelin, things like that. And that improves insulin sensitivity, produces hunger signals.
So it really underlines that the surgery isn't just a physical thing, like making the stomach smaller.
Exactly. It's a metabolic intervention.
But the source is also careful to say, look, the potential benefits are profound, sure, but it's not some kind of magic bullet.
No, absolutely not. And it definitely comes with serious considerations and risks.
Which I guess is why the book puts such a strong emphasis on preparation.
And it's not just the medical tests and getting cleared for surgery. Dr. Ahmed details things like preparing your home environment for when you get back, recovery,
Right.
thinking about how your family is going to support you, planning for time off work, even, the financial side of things.
That level of detail feels important.
It's crucial. It really highlights that a successful outcome relies pretty heavily on having a good support system in place and having those practical things sorted out beforehand.
Okay, what about the actual mechanics, how the surgery works? Does the source get into that?
It does, yeah. I mean, there are several types, obviously, but the book simplifies it a bit by focusing on the two main ways they work. So there's restriction, basically reducing the stomach size to limit how much food you can take in, like the sleeve gastrectomy.
Okay.
And then there's malabsorption, rerouting the small intestine so you absorb fewer calories and nutrients. That's more like the gastric bypass, which often combines both methods.
Understanding those basics probably helps clarify why different procedures might have different results.
Absolutely. Different effects, different potential outcomes, different risks too.
And then moving beyond the operation itself, the source really seems to drill down into the long-term commitment needed after surgery.
Oh, completely. This isn't just about losing weight initially. It's about, well, a whole new way of life. The book gives a lot of guidance on nutrition, the importance of protein, figuring out new food tolerances.
And the vitamin and mineral supplements, that seems like a big one.
It's essential. The book stresses it's lifelong and absolutely necessary.
Not optional.
Definitely not optional. It explains that because of the changes in digestion and absorption, you can easily become deficient in things like B12, iron, calcium, vitamin D. These need constant monitoring and supplementation. Otherwise, you risk serious health problems down the line.
Okay. That's critical.
The book also covers managing medications post-surgery because they can change quite dramatically as health conditions improve.
Right, like if diabetes gets better.
Exactly. And the importance of regular follow-ups.
Mm-hmm.
With the surgical team, dietitians, other specialists, it's ongoing.
And it sounds like it covers troubleshooting, too. because, any surgery has potential downsides.
Yes, it addresses how to spot and manage potential complications.
Yeah.
Things that might happen soon after a surgery, but also longer-term issues like ulcers or those nutritional deficiencies we mentioned.
And it anticipates different life situations, too.
It does. The book mentions navigating specific scenarios,
Right.
like pregnancy after bariatric surgery, the considerations there,
Mhm.
or the timeline and options for cosmetic procedures, for excess skin later on, and how to approach cases that might be more medically complex from the start.
That really shows how comprehensive it aims to be. It's trying to equip patients and doctors.
Yeah, giving them the knowledge to handle the whole journey, not just the first few months.
So this all seems to reinforce that core message you mentioned from Dr. Ahmed's book.
That bariatric surgery can enable this profound transformation, but
It only really works out fully through good patient education, setting realistic expectations.
a real commitment to those lifestyle changes and the follow-up care. It all has to work together.
So the source really positions knowledge itself as the key tool.
Yeah, not just information, but the tool for navigating this really complex process successfully.
It's about empowering you, the listener, to have those informed, confident discussions with your own medical team.
Right. It provides those detailed answers, hopefully with some empathy, that you need to make what's a very significant decision feel maybe a bit more manageable, less overwhelming.
And the fact it's also aimed at doctors suggests it's trying to create a sort of shared foundation.
I think so. A shared understanding, making sure conversations are based on current clinical thinking and best practices.
Okay, so wrapping this part up, what does all this mean for you listening? Well, it means if you're exploring bariatric surgery, or even just curious, diving into a resource like Dr. Ahmed's book shows it's viewed as a powerful tool for health improvement.
A very powerful tool,
Mm-hmm.
but one that demands quite a bit.
Right. Significant preparation, understanding how the surgery actually works, committing to pretty profound lifestyle changes.
Diligent follow-up, being aware of potential challenges, thinking about specific life scenarios down the road. It's a holistic thing.
Exactly. It's seeing the whole picture, not just the operation, but the entire journey. From thinking about it, preparing, recovering, and crucially, that lifelong adaptation and care needed to keep the benefits going.
Makes sense.
So, just to recap then, we've taken a deep dive into the source, Dr. Ahmed's Q&A guide. We've seen how it frames bariatric surgery as this transformative option for severe obesity and related health issues.
Highlighting those metabolic impacts, not just weight loss.
Right. And the critical importance of thorough preparation.
The details of long-term nutritional needs, the supplements, the follow-up.
Managing potential issues, addressing specific future situations.
And all of this really underscores that central principle from the source. Successful transformation hinges on patient education and realistic expectations.
Yeah, having that knowledge base seems fundamental to engaging with your healthcare team effectively, making the choices that are right for your own health journey.
Absolutely. Which brings us, I think, to a final thought for you to consider. It's drawn from this idea we've discussed. The bariatric surgery enables profound transformation, but relies so heavily on patient education and realistic expectations. So the question is, what does that suggest about the balance? The balance between a powerful medical intervention on one hand and the individual's ongoing personal journey towards health and well-being on the other.